Some more antidysrhythmics that you might see. One very common drug for cardiac dysrhythmias is lidocaine. The same kind of lidocaine that is used to numb the skin topically. If it's given IV, it can also correct abnormal heart rhythms because it blocks sodium channels. So just like the procainamide, lidocaine is very similar. Now, lidocaine is not discussed in our book, so I've added this information. But if it's used locally, it deadens the nerves. It stops nerves from sending signals, and it does this in the cardiac system also. They use lidocaine usually in the ICU setting for ventricular dysrhythmias that might be fatal. It increases the strength of electrical impulses, and it is going to send definite signals telling the heart when to beat and when not to beat. Usually somebody will be on a lidocaine drip that they titrate up or down depending on what the patient's EKG shows. Another drug that is commonly used, although it has a lot of cautions to it and it has to be done under strict supervision. Adenosine given IV actually stops the heart for several seconds and allows sort of a chemical cardioversion, just the way when an AED shocks the patient's heart back into normal rhythm, the adenosine does that chemically. It is a very powerful drug, and some patients find the experience of having adenosine used on them so unpleasant that they refuse to ever do that again. Now, if a patient is going to be started on adenosine PO, usually they're going to put them in the hospital for a day or so they can be continuously monitored. And if they don't react well and they need to be resuscitated, they've got all the equipment right there. The National Institute of Health has a section on adenosine. They talk about that. It's very interesting. And I'm going to post the link to a YouTube video that shows a patient being having adenosine used on them. That's also very interesting. Once again, beta blockers like propranolol will block those beta receptors and make the heart not quite as responsive to epinephrine and norepinephrine as it would otherwise be. So propranolol is a very common drug for dysrhythmias. These drugs can cure one dysrhythmia but then cause another one. So most of these medications are going to be used under supervision if they're being used IV. PO, there's going to be a lot of checking on the patient to make sure that everything is working properly. You want to watch out with the drugs like quinidine. You want to watch out for a condition called synchonism or synchonism. It's quinine poisoning. This particular drug can become toxic when it builds up in the system. The first sign of quinine poisoning or quinine toxicity is tinnitus. The person will start having weird buzzing and ringing in their ears. They might get lightheaded and dizzy, feel like they have vertigo, the room is spinning. They can get a headache, nausea, and vomiting, and they can run a fever. So quinidine, which is an older antidysrhythmic, is sometimes used very effectively, but it can become toxic. And so we want to warn our patients about the signs and symptoms of quinine poisoning. Before you give any kind of antidysrhythmic drug to a patient, you want to listen to the apical pulse for a full minute, 60 seconds, just to make sure that you've got a good rate and rhythm, and there's usually going to be parameters given when you should hold that drug.